just so that we can show the joints that we just discussed on the lower extremity. Here is the pelvic girdle of a male and female. The way that you tell male from female, if you look at this side, this one right here, if you look at the angle right here, this angle is actually only a 60-degree angle of the pubic symphysis right there. You have rather upright crests of the ilium for each of the os coxa, so it's upright, and this foramen is a little bit smaller on this one. The same is true for this, except for the fact that we have an angle here that looks a little bit different. These are actually both males. The difference that we would see in a female would be that this angle is a full 90-degree angle, a right angle. The ilia would be laying down, and this foramen would be much larger here. So notice the sacrum is going to articulate posterior and medial with the os coxa, and the pubic symphysis is anterior, and the lateral articulation would be with the head of the femur into the acetabulum. Okay, the last articulation with the lower extremity would be seen right here in the knee, right? And we just discussed that a moment ago, and the articulations we see here would be that the femur, the condyles of the femur, sit down onto the condylar facets right down below on the tibia, and we also have on the anterior surface of the distal femur the patella, which is a sesamoid bone, a short bone embedded in tendon, and that patellar tendon is going to come down and attach to the tibial tuberosity below. The medial and lateral collateral ligaments are here, stabilizing the knee. Then you'd have the meniscus of the knee right there in between the condyles and the lower leg, and you'd have the anterior and posterior cruciate ligaments that you can see here stabilizing the knee joint. That's the lower extremity joints.